A few moments later.
Medial thrust. Definition: the knee moves medially toward midline during the stand phase of gait. Thomas knee flexion. Definition: the knee remains in the flex position more than normal during stance or swing phase.
Based from the video, the first is plane. So when I observe the gait deviation from coronal plane, the second is pace of gait during mid-stand, and the third is position. We can see the patient walk in medial border of the foot. The fourth is foot, and there is lateral head of the foot. The fifth is pylon. Then the pylon is sliding medially, and the sixth is location of GRF, and the GRF lateral of knee joint. The seventh is moment. This gait deviation creates knee valgus moment, and the eighth is gap, and there is gap in medial proximal of the socket. And the ninth is pressure. The pressure in proximal lateral and medial distal, and the last is concussion. So we conclude the patient walk with medial thrust. Based of the video, the first plane, so when I observe the deviation from sagittal plane. The second, pace of gait during terminal stand. Third, position, we can see the patient walking down a heel of the foot. Fourth, foot, and foot is set to match dorsiflexion. And the fifth, trunk, then the trunk leaning backward. The sixth, pylon, the pylon is leading anteriorly. 7. Location of GRF, and the GRF pass more posteriorly of knee joint axis. 8. Moment, so we describe excessive knee flexion moment. And the 9. Gap, and there is gap in anterior proximal of the socket. 10. Pressure, the pressure in anterior distal posterior proximal. And the last conclusion, so I conclude the patient walk with too much knee flexion or less than.
Causes too much knee flexion. Prosthetic causes. First is socket is in too much knee flexion. Correction, extend the socket and shift the socket anteriorly. And the second is socket is set too much anterior. For the correction is shift the socket posteriorly. And the third is dorsiflexion bumper too soft. Fourth is prosthetic foot too small. And for the amputee causes, the knee flexion contractor. And the second is causes of medial thrust. And for the causes is socket placement too much medial. For the correction is shift the socket laterally. And the second is excessive abduction of the socket. And for the correction is abduct the socket and shift the socket laterally.